Malaria is a disease that kills over 1 million children still every year in the world, and most of those are children under the age of 5. And there's a real need to develop new drugs to treat malaria because the parasite that causes the disease is increasingly resistant to currently available therapies.
Our lab is primarily focused on urinary tract infections, and E. coli is the main cause of those. We study how the organism avoids the activity of the immune system in the urinary tract in order to cause UTIs. So really what we work on most of the time doesn't have anything to do with malaria, for example, but the organism is very genetically tractable.
We were particularly interested in a small molecule called fosmanamycin. So this is a molecule that's actually being used as a drug right now. So it's currently in phase 2 clinical trials being used in combination therapy to treat malaria. And the molecule was thought to inhibit this isoprenoid biosynthesis pathway in the malaria parasite. But the previous studies that had looked at the drug had really conflicting results. And so we developed a method to detect all the metabolites of the pathway. So if you think of the pathway as a pipeline from A to Z, D didn't go down, D actually went up, which is totally the opposite of what was predicted. And in fact, the block looked like, instead of being between C and D, between D and E. So this was a really surprising result. And everyone I mentioned it to said, well, the malaria parasite's just weird. This drug, fosmanamycin, you can treat regular bacteria with it, and I'm sure it's on target in regular bacteria. This is just something weird about the drug in malaria. And that's how we got involved with working with David Hunsted's group to try to see if it was doing the same thing in bacteria as it is in malaria.
This is just a byproduct of Audrey and my offices being right together. We see each other almost every day, and on this particular day she came by to show me some new data that she had, and she said, I want to do this in E. coli. And we work on E. coli, so it seemed like a natural place for us to start talking.
This is, it looks like it's RAD5.
Oh, I see.
Once I learned more about her pathway, it became obvious that the things she wanted to do were probably easier to do in my organism than hers, and that's where it got started. You wouldn't think that they would have much in common, but this pathway, the pathway of isoprenoid biosynthesis, is common to malaria, E. coli, and a lot of other bacteria. But the thing that makes it an attractive target is that it's not found in humans. So if you can block it, you might expect that you wouldn't have very many adverse effects in people taking a drug.
So in theory, if we get a good drug that targets this pathway, we have almost the true magic bullet, right? We could treat malaria, treat TB, and maybe even market it in the US for, hospital-acquired infection.
We were able to make mutants in E. coli and otherwise genetically manipulate the system in that organism a lot easier than we could in malaria.
A major problem in developing new antimalarial drugs is that you can't get pharmaceutical companies interested because they'll never be able to market them. They're going to have to give them away to developing countries. But with our target, we think we have something that we can get pharmaceutical companies interested in, but still have real important uses to solve global health problems.
I think we'll continue to work together. It seems to have worked out very well so far, although I don't know if Audrey is going to need me quite as much because her lab is starting to do more of the E. coli work themselves, but we'll definitely be around to help her out and advise her as she goes forward with this project.